Shout out. Hello, everybody. Good afternoon. Dr. Barry, board certified internist, founder at drpierresblog.com, author, speaker, soon to be podcaster. Please be on the lookout for that. Today, another edition of The Lunch and Learn. We're going to give, like we do every Tuesday and Thursday, give you a couple minutes to kind of get on, find a nice place to kind of quick listen to. And today we're going to be talking about heart attack. So I'm going to do my little maintenance where I kind of share out to my regular professional page, and then we'll kind of get this thing started. But today I do want to kind of highlight, we do have a special guest this month, my actual medical student. Heather, we're just going to just turn that camera, say hi. Hello, hello. So this is Heather, and my wife has just joined. Hey, Maria, thank you for sharing. Today we're going to be talking about heart attack, signs and symptoms of the heart attack. So again, when you get a chance, go ahead, like and share. And again, like I always do, I always like to shout out all of my replay viewers. Again, I always forget about y'all. I apologize. Shout out to all the replay viewers who may not have a chance to catch up, live when I am watching this, when I am doing my lunch and learns as well. So we're just going to give a quick few seconds, and we're going to do a rundown of about 10 or 11, signs and symptoms that you should be worried about, focused on when we're talking about a heart attack. Again, remember, this is Heart Disease Month, and so all of my posts and everything that we've been doing, from a blog post and the live, have kind of been kind of pointed to that direction. All right, let's see. So that is, so I always, because I do this off my professional page, so then I'll share it to my personal page. I actually have more people who follow me on, because I have more Facebook friends on the other page, so they'll usually will see the post there. All right. So we're going to get this thing started. So again, introduce myself again. I am Dr. Barry, board certified internist, founder at drpierresblog.com. This is a special guest. This is my medical student this month, Heather, from Nova Southeastern. She is going to be a future, we're not even sure yet, future pediatrician, pediatric oncologist, or maybe a pediatrician kind of specializing in child development. She's a third year medical student, so she has a little bit of time to kind of focus on that, but we're definitely going to kind of help her get her to this point here. Today we're talking about signs and symptoms of a heart attack. Again, if you've been following, I think this is episode 19. You've been following our last episodes, have kind of been going along with this theme of heart disease and all of the things we've talked about. Cigarette smoking, we talked about high blood pressure, we talked about heart failure. Today we're going to talk about signs of heart attack. This is a very common question I get in my office quite a lot. I get a lot of patients who come in to the doctor's appointment with chest pain, and they always want to, anytime you have a person complaining of chest pain, their first concern is I want to make sure this isn't a heart attack. That's always the first thing they want to kind of rule out first and foremost. So we're going to go, pretty fast. Like I said, I will write up a blog post tomorrow going on a little bit more detail of some of these signs and symptoms, what to look for, what to do if you're starting to experience these symptoms. But I do want to kind of put out there the most common symptoms that we kind of deal with on a day-to-day basis. So when we talk about heart attack, first and foremost, chest pain, right? So that should be number one, right off the bat. If you're having some chest pain, in particular left-sided chest pain, the concern for heart attack kind of increases with us, right? And it's probably one of the most common complaints we get in the office, common complaints we get in the ER as well. Hey, Chesty, first of all, thank you for joining the live. We're talking about signs and symptoms of a heart attack. Our first one was chest pain. Number two, I do get some patients who will tell me they're having some jaw pain as well. So, and you'll see the theme. A lot of it tends to be left-sided, only because that's where our heart is on the left side of our body. So a lot of times I'll get patients complaining of jaw pain along with some chest pain as well. Sometimes people have trouble chewing. Some people just a sharp sensation that kind of radiates to the jaw. So that's another a common complaint I usually will get in the ER, in the office as well, when they're worried about whether they're having a heart attack or not. Shortness of breath. Shortness of breath is another key one. Again, I know we always think about the heart and some of its function, but it's very common if we're having especially if we're having a heart attack or anything related to the heart, that you then start becoming short of breath. Because remember, your heart's job is really to kind of pump blood out, especially oxygenated blood to the rest of the body. So if we're having trouble doing that, and sometimes that does occur when we have a heart attack, you can get short of breath as well. So shortness of breath could be a presenting sign for it. I have some patients who get nauseous. Some patients who get nauseous, some patients who vomit. And this is in particular for my patients who are diabetic, right? Because, and even though I'll talk about these signs and symptoms, my diabetic patients, like we put them, and Heather knows, we put them in like a special category, right? Because they don't necessarily get the prototypical chest pain, jaw pain. That doesn't really resonate with them. And that's just the way diabetes works. Diabetes, you don't necessarily feel the same way that you feel for a person who isn't a diabetic. So when we talk about these signs and symptoms, I am talking about my non-diabetic patients, with the understanding that my diabetic patients may get like very different symptoms and still be having the same heart attack and crushing pain that you may not be experiencing as well. I have some patients who get this epigastric pain, and again, right a little bit above the stomach, almost seems like an upset stomach as well. And again, that's a big concern for us. Again, because of the size of the heart, because of where the heart's located. Not only can you get pain that radiates to the jaw, you can get some pain that kind of sits right in the mid-chest as well. So mid-epigastric pain is something that, if you have, a relative, older relative, and not too old, but, if you have a relative who's experiencing some of these signs and symptoms, we have to be very wary of. Hey, Jose, thank you for joining. Jose, we're talking about signs and symptoms of a heart attack. That was number 5 of epigastric pain. Sweating. Sweating is a very common sign and risk factor that I hear a lot about as well, is that a patient will be having this, this vague chest complaint, but then they just start profusely sweating, like as if they're like just ran a mile. They're just sweating, and your body goes through this hormone experience when you're having a heart attack that can cause you to start profusely sweating, that can cause your heart rate to profusely start rising as well. So, profusely sweating is a concern, especially if you couple that with some chest pain, couple that with some nausea and vomiting, that, my brain is like running wild and say, oh, this might be the one for that standpoint there. We talked about the nausea and vomiting, but again, my diabetics, a lot of their complaints, and even and I say diabetics, women as well. And you see, if you'll do some of your research, sometimes women don't present very prototypical of, the chest pain radiate down to my left arm. They don't really get that, but they'll have heartburn sensation where they're just not feeling well, and they're still having the same chest pain complaints, the same heart attack symptoms that everyone else is getting. Upper back pain, and the upper back pain, especially like in the mid shoulders, is very particular for heart attack. Reason being is that it can kind of give us an idea of where the heart attack is occurring, especially the location is concerned. Because most of our patients, when they do have heart attack or they're experiencing heart attack, they tend to give us the same, the book story is they'll give us this pain that, hurts in the chest that kind of, goes down to my arm. But some people will get this pain that hurts in the chest and goes in the back. Sorry about that. And that's also a big concern for us as well. So, where the chest pain, where the pain, moves to when it's starting from the chest is definitely, a concern, and definitely something that makes, our alarm bells start ringing as well. And I kind of alluded to arm pain as well. Depending on the books you read, your prototypical story, movies always says radiate to the left arm. But I have a lot of patients who have right arm pain as well too. So, and again, remember the heart, pumps blood everywhere. So it's not like it only pumps blood to the left side. So you can easily get some right arm pain as well with the jaw, just like right jaw pain as well when you get a heart attack. So again, these are, things to always kind of look out for in a grand scheme of things. So that was number 10, just a general feeling weak, right? we would hope, right, that all of our patients who had a heart attack came with these same, prototypical symptoms of, hurts here when I breathe, chest pain right here, this is the sign where they start grabbing the chest. We would love that to occur. But unfortunately, that doesn't happen with everybody. Some people, they just start feeling, they don't feel very well. It's just this weak sensation that, they really can't explain it. And that's enough, to cause concern. And again, and that's really when we're talking about my diabetic patients, when I'm talking about my female patients as well, those who don't really present in that same, that classic book way, is definitely something that we very keep mindful of. And last but not least, again, that was 10, and we'll go over those 10 again. Sometimes they don't feel anything at all, right? And that's the worst, right? So sometimes there's no symptoms, there's no chest pain, there's no shortness of breath, there's no arm pain, there's no weakness, there's no fatigue, there's no symptoms whatsoever, and they still can experience a heart attack. And, those are, it's unfortunate. And again, those tend to, and this is for my non-diabetic patients, they tend to, it isn't typical, but it can occur. So again, and sometimes a lot of patients, like when I'll do like an EKG and I'll say, oh, it looks like you had a heart attack in the past, and they have no clue. Because sometimes we can have, like, just like you can have what you probably heard, like a mini stroke, you can have a mini heart attack as well. And sometimes it's enough to, cause damage to the heart, but not enough to really send to the hospital, not enough where it even stops you in your tracks. So let's, we'll go from, 1 to 10, kind of recap. Like, again, first, thank you for joining. We're talking about signs and symptoms of a heart attack. Again, we're still in the thick of Heart Disease Awareness Month, so I wanted to make sure I touched on that, especially because I have a lot of my people who watch the video, who have older relatives, who have grandparents who stay at home with them, and these are things to really look out for, when they start complaining of these vague symptoms, so definitely to be very wary of. So first and foremost, number 1, we talked about chest pain. Number 2, we talked about jaw pain. Number 3, we talked about shortness of breath. Number 4, we talked about nausea and vomiting. Number 5, we talked about epigastric pain and discomfort. Number 6, we talked about sweating, just like this profuse, sweating symptoms. Kind of coupled with a lot of these other complaints could be pointing to concerns for a heart attack. Number 7, we talked about heartburn, indigestion. Number 8, we talked about, upper back pain. And again, that kind of points to, where some of the pain will go from. Sometimes it starts at the chest and goes somewhere. So upper back pain as well could be a very common complaining presentation of it. We talked about the arm pain. Again, most people know about left-sided arm pain, but right-sided arm pain cannot be neglected as well to be concerning for chest pain and heart attack symptoms as well. And we talked about just generally feeling weak and fatigue and just not really feeling themselves moving forward. And last but not least, we talked about no symptoms. Like, even though I listed about 10, sometimes you can have no signs and symptoms and still have the heart attack. And, that's just as concerning, and that is something that, and that's why it's so important to, see your doctor at least once a year. Like, if you have to see him more, but at least once a year, you should be seeing your physician, getting your routine checkup. If you're having complaints of chest pain or discomfort, making sure he's doing like an EKG just to make sure your heart's doing well from that standpoint. Like I said, I talked about, I think a few episodes ago, where I talked about my patient who was like 36, and he had a triple bypass surgery, and he was this weightlifter. He thought he was on top of the world, but he had all of these other issues, and he had the nausea and vomiting, just like this epigastric pain that he thought it was just heartburn, and kind of brushed it off until the heartburn came back, and it came back even more, and he said, I'm just going to go to the ER just to get a quick checkup. Next thing you know, 2 weeks later, he's leaving the hospital after getting a bypass surgery. So definitely, hey Marie, thank you for joining. We talked about signs and symptoms of a heart attack, and we kind of went over this. And then tomorrow, I will be posting a blog just to kind of giving ideas as far as all the signs and symptoms we talked about. So again, definitely something to be concerned about. Hey, Vishal, thank you for joining. We talked about signs and symptoms of a heart attack today, and we went through like 10 very common symptoms. And again, my special guest is my medical student this month, Heather, future pediatric oncologist or a pediatric specialist in child development. So we're very excited to have her on the Lunch and Learn this month as well while she's here. Learning as whatever I can try to teach her as much as possible. So again, guys, thanks for thank you, Vishala. Again, thanks for joining the Lunch and Learn. Again, I know for my replay viewers, thank you for watching this later. I know a lot of you guys work, so you can't watch it live. But again, I'm always available for questions, concerns, for anything you see I do a video of. You can always leave a comment under the video, and I can always answer that question if need be. Tomorrow I will be doing a blog post on this topic as well. We'll go a little bit more detail of some signs and symptoms and what to do next if you do get these issues, because we didn't really touch on that in this video here. I want you guys to continue to have a great blessed day. I will see you guys on Thursday for the next Lunch and Learn. I'm not sure what I'm talking about. I'll think about it Wednesday. It'll probably I'm probably going to touch on, because this month, I know we've been talking about heart disease a lot. This month is actually also teen violence month as well. So I may touch on something, related to more like adult violence, domestic abuse, something in that, in that window. Just again, because we want to, make sure we celebrate all of our issues from a health perspective standpoint. But you guys continue to have a great, blessed day. I'm actually going to go and I will post this on the website, drpierresblog.com. If you have not had a chance, go ahead, check that out, sign up for it so you'll get my blog post directly in your email the night before. And you guys have a great day. Bye.